Mr. Chairman, we have quorum.
All right, Nina, thank you very much. So we're going to jump right in, folks. Apologize for a few minutes being late with the technical difficulties. And I think it's a little bit of the story of 2020 as we go into 2021. I'd like to, as we start today's meeting, obviously, we've been working extremely hard this past year. The team's done a great job. The local workforce development areas have adjusted just to serve our constituents in our respective areas. And I just want to thank everybody for the hard work. And we've been agile, as you can say, as we've made adjustments. And I'm really proud of the work that everybody's put into it. And I want to thank my fellow board members for your commitment to making these adjustments. And so we're looking at the world today. Things are evolving. And I think one of the biggest things on the radar screen today is the workforce challenges, the need of the workforce. And so the things that we're paying attention to, working on, we're right in the middle of it. And so we'll get a couple updates on some areas of interest for us, and looking forward to the presentations and also engagement from our board members. So Ania, thank you, and Kristen for organizing all of this, and we'll jump right into our agenda here. I'll first start off with some staff changes. And I think all of you know Jamie Jordan, and Jamie has accepted a position with Accenture and will be leaving us at the end of the month. And I just want to, I know that you see the slide here. I've worked with Jamie for quite a while, and I will miss the in fact, Jamie, I'm going to embarrass you a little bit here because I know we've talked about the org, the things you've worked on, and your passion and energy comes through crystal clear, which we love. And in one of the presentations you were giving, I think I called you King Jordan, because it was staff change, but I know you reacted to that in a very funny way. And I just want to let you know that we appreciate your service. We appreciate your commitment, your energy. You're truly our servant leader, and we know you're going to continue to do many great things, and you will always be a friend. And we wish you much success. And Jamie, I think he's on.
I am. Thank you very much, Mr. Chairman. I appreciate that more than you know, and the pleasure has truly been mine. It is crazy to think that it has been 8 years, but I have been working with the office and the board for 8 years now, and it has been the best professional chapter I can ask for. It's always tough to take that next step and turn a page, but I am excited for this next step and the chance to keep working with leaders and public servants just like you guys. And so this is my passion. It's what I love doing. And the hardest part has been the family now that I've gotten to work with in this office for 8 years, and then walking away from that is always hard. And that's what I told the team that reached out to me. They had a high order to make that work, and they were able to manage that. But appreciate those words, and appreciate all that you guys have done for the board and for our office over the years.
Thanks again, Jamie. Congratulations. All right. So with that in mind, in order to accommodate us losing Jamie, we have shifted 2 divisions over to Brittany Walsh, which was formerly Brittany Singer. Her title is now the Programs and Compliance Director, and she'll be managing the compliance programs and strategic populations team. And I think you see it on the slide here. And then to backfill Jamie's position, we'll be hiring a business services director, and this position will manage the business services and apprenticeship teams. And then we've made progress with the hiring of an apprenticeship manager. Marcus Weathersby will be starting with our office soon. And when he gets settled, we'll move forward with hiring an additional specialist in this area. And last but not least, the data, strategic populations, and programs teams each have 1 open position, and they're currently working with HR to fill those spots. So we appreciate the change. Things will continue to evolve, and And we appreciate the work that the team is doing. And then one last thing is it's a friendly reminder that many of the board members were appointed on May 21st, 2018. And it's a 4-year appointment. So our current terms do not end in 21. They actually end in May 21st, 2022. So we apologize if that's created any confusion. So again, that's we're appointed through May 21st, 2022. All right. So we'll jump right into the agenda. Going for the first portion of the business side here. We need to approve our May 20th, 2021 agenda. Do I have a motion to approve?
This is Dale Keith. I approve.
Go ahead.
All right, we have a motion. Do we have a second?
Second, Susan Andrews.
Thank you, Commissioner. Any questions or discussion? Hearing none, all in favor say aye.
Aye.
Any opposed, like sign? All right, motion carries. Thank you. You also received in the packet for this board meeting the minutes from our February 18th meeting. So do we have a motion on the floor to approve the minutes?
This is James Wilburn. I move to approve the minutes.
Thank you, Dr. Wilburn. Do we have a second?
Tyrone Oliver.
Evelyn Lennox.
I think it was Tyrone Oliver. All right. Any questions or discussion?
Commissioner Dallas,
Yes.
this is Karen. There are a couple of things I noticed on these minutes. The date, Friday, February 18th, we need to fix that. It was Thursday. And one other item under the committee meetings, we have 2 comments here under the committee meeting, and this is the meeting I was not present at, but there's a comment. It says the Adult and Dislocated Worker Committee had a quorum, and then the next line said did not have a quorum. So I think we need to just amend.
Okay, so Ania, so Karen, you're making that as a amended motion, correct?
Yes, I think we need to amend the minutes.
Okay. So,
Okay,
so
I'll make sure I
she's
make
made-
those changes.
all right, and so we have an amended motion here. So I need a second on this and what Karen just said.
Second, Gerald Mitchell.
Thank you, Gerald. Any other questions or comments? All right, hearing none, all in favor of this motion, say aye.
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 Any opposed of this motion? All right, hearing none, motion carries. Thank you, Karen. All right. We will move straight into the next agenda item. And Nia, keep me honest here, the committee reports. And first up, we'll have Karen Vieira, Chief People Officer of Church's Chicken. She'll give us an update. Karen, the floor is yours.
Thank you. Thank you. This will be a brief update. So we did not have any action items to meet on or to vote on. And on our prior committee meeting, we had touch base with all of our committee on what was happening in the businesses, what was the changes, what were the challenges. So we made a decision with Dee Dee changing her role and not having items to vote on or no action items to approve. We did not hold the meeting to give everybody back the time that they may need. And with that, I believe that we do have a report by Jamie at this time if he wanted to share it. Is this the appropriate time, Jamie?
Yeah, absolutely. So I won't take too much time. We just wanted to provide you all with a brief update on the COVID Dislocated Worker Grant to let you know where that stands now and a few updates we've had on the grant over the past few months. So we, about 6 or 7 months ago, as we were experiencing some challenges with filling some of the temporary employment opportunities, submitted a grant modification to USDOL to propose adding two other sections of jobs that would be allowed under the grant. So we did vaccine related jobs at their vaccine sites, and then also testing related jobs. And that we basically threw the kitchen sink in of all the types of positions that could be included in those operations, even up to the healthcare workers who could actually administer the vaccine. And as expected, it did take much longer than we were wanting, but we did ultimately get that approval. And so we were excited to get the approval, and they approved all the jobs that we proposed. It did have some challenges. The delay really made some of our areas miss some strategic opportunities once, as you know, a month or so ago, once vaccines started really ramping up, they had missed the key time right before that to get involved to really be able to fund some of those opportunities. So I think we would have had greater success with that had we gotten that approval about 2.5, 3 months prior to when we did. But nonetheless, we did get that approval, and we still now have that opportunity to continue to offer that support to both vaccine and testing sites across the state. With that being said, we are currently in the middle of doing kind of a reassessment of our strategy for the grant for the remainder of that period, which runs into the beginning of summer of 2022, to look at making sure we fully utilize those grant funds in the most effective way. As you know, as a reminder, the funds can be used in two different ways. The first is what I just mentioned, so those temporary employment opportunities, giving people short-term employment to help mitigate the impact of the virus. And then the other side is just the training the way we do with our traditional formula funds. They're dislocated worker dollars, so it allows us to train dislocated workers to get them placed back in the workforce. It's a little bit expanded dislocated worker eligibility than traditional dislocated workers, but very similar. But it just allows we have more flexibility with those affected by this unique situation than you would typically with DW. So right now we are going to be proposing to our local areas for them to assess what their original proposals were from the number of participants in temporary employment and those in training services, so that as we now shift, as Georgia has now decided, the governor decided, to not continue the federal assistance that goes with the unemployment, we anticipate that will likely lead to an uptick in demand on our system. And so we're asking our local areas to do an assessment of how they think that will affect their enrollments and their impact on this grant, so that then we can potentially reevaluate a potential grant mod to shift more of our proposed numbers to the training side to try to get ahead of what we know may be some occupational shifts in the marketplace here in Georgia due to the COVID pandemic. So we're right in the middle of that now. We're going to be discussing that actually on our local call later today. But good stuff still happening. There have been challenges. Obviously, this is a unique crisis that none of us have ever encountered before. And we are in the unique situation where we're lucky to have a good bit of federal assistance to help people. So it doesn't put any undue pressure on one specific system of assistance. And so that has created challenges. And I say that in air quotes because it's good that we don't have a lot of people desperate for our work, but it has made it challenging to fulfill the original proposed vision for the grant. And so we're just looking at how we can shift that to take the grant funds we have been awarded to help people where their need is. And so just wanted to give you guys that update. We will keep you updated, obviously, in future meetings as we make more decisions on what type of grant modification we submit, if that's where we ultimately go. But that's where the grant stands now.
Thank you, Jamie. And just before I turn it back over to Commissioner Dallas, I'd like to say that it has been a true pleasure working with Jamie and the entire team. I joined 8 years ago, and Jamie has just been a tremendous support and help, and he will be missed, and can't thank him enough for his time, his effort, his passion, and just desire to help those in the state. So a special thank you and good wishes, and really appreciate all that you've done. Thank you.
Thank you so much for that. I appreciate it.
Wonderful, Karen. Hey, folks, any other questions for Karen or Jamie and any of the other adult dislocated worker committee members? All right. Great. Thank you again, Karen. We'll move now next to the Youth Committee. So Commissioner Susan Andrews, the Vice Chair of the Harris County Board of Commissioners. I'll turn the floor over to you.
Thank you so much. As you can see from the screen, we had no action items at our meeting on May the 5th. However, we did hear an update from the Savannah River area about their continued, I like the word, being agile in these hard times. They had a drive-through job fair, and they had 39 representatives, 21 businesses, 65 job seekers, and it was quite a day for them. And so they're continuing to meet the needs of youth and dislocated workers, even in these crazy times that we live in. We also heard a report from Rosani Rios about the new youth resource guide that will be on the website, and it will have all sorts of information, youth related topics, guidance, suggestions, and tools to the local areas, and questions and answers on there also. So it's just a new guide for them. We did a round robin on what are the lessons learned from the pandemic, what things will we continue to do differently, even if we can go back to normal. So we had a lot of discussion about those kinds of things. How has the creativity of service, even in a very tough time, something that we will continue, which things we can't wait to get rid of and get back to normal. So we had no action items, but we did have a very good meeting, and it let us know that even in the midst of all of this, good things are still happening, good work is still happening, and good service is still going on. So thank you to the staff for all of that. And Mr. Chairman, we don't have any action items, so I return it back to you.
Well, thank you very much, Commissioner Andrews. We appreciate the work that you and the team are doing. I'll open it up to the board. Any questions for Commissioner Andrews or any of the youth committee members? All right. Thank you again.
Thank you.
We'll move on to our next committee. Dr. James Wilburn is a director for the military academic programs for Georgia Tech Professional Education. So Dr. Wilburn, we'll turn the floor to you for the Performance and Accountability Committee update.
Sure. Good morning, Mr. Chairman. The Performance and Accountability Committee met on Tuesday, May 11th. We did have a quorum. The meeting started with Director Stephen Wilson providing an overview of statewide cost benefit impact that he will cover in greater detail during today's meeting. Next, Stephen presented an update on eligible training provider waivers. As we know, eligible training providers are required to report outcomes for all students where WIOA funding is utilized, and not just those students utilizing the WIOA funding. We received a waiver since the beginning of WIOA, exempting us from having to report performance metrics for non-WIOA funded students. So these are the students that are in ETPL approved programs, but are not receiving the WIOA funding to attend those programs. However, the waiver runs out June 30th, 2021 and will not be extended. The October 2022 report for PY21 will need to include outcome information for all students of eligible training programs. Further information is going to be provided to determine how best to receive this information. So not just the students receiving the WIOA funding, but the non-WIOA funded students attending ETPL approved programs. Finally, the committee welcomed Fulton Director Brett Lacey, who provided a very informative presentation on how Fulton County is able to use data to drive board engagement to get them more involved with the work that's being done. The concept used by Lacey's team includes reporting out performance numbers on a more real-time model by pulling information from GeoSolutions or FutureWorks. The purpose is to provide a better understanding of how customers are moving through the system from start to finish, provide information on how dollars are being spent, and comparing outcomes to other areas. This includes, this information is presented each quarter. Some of the areas being tracked include numbers on percentages that completed the training program, how many withdraws, how many are employed in the sector they were trained in, tracking how long they've been in the program, and tracking return on investment. That concludes the discussions on the meeting we had on May 11th. There are no action items, and if there are no questions, this concludes my report, Mr. Chairman.
Thank you, Dr. Wilburn. And I know we can maybe answer questions later just from the local areas. I would be curious to see how the local areas are responding in this space with our performance. And I know we're going to we'll continue to recognize them and highlight many of them in our meetings, but just want to make sure that is there anything going on the ground, I guess, in a sense, that we have any concerns about with some of these changes and explorations? Are we good there, or what kind of feedback are we getting? Do we know?
Stephen, are you on? I know we talked a little bit during the meeting about some of the feedback or some of the concerns that you're already hearing. Are you on the call?
If Stephen doesn't jump in, this is Kristen. I mean, this is definitely a change that is causing some heartburn. We at the state level tried to delay as long as we could. Unfortunately, while we had a waiver for this for many years, we were notified that future waivers weren't going to be granted. So while it is going to be kind of a considerable task, and the fear is that we will lose providers off the eligible training providers list, it's kind of one of those things where we have no choice. And so I think because of that, the local areas know the position that we're going to be in. We're going to do our best to offer as much support as we can. And there are groups of providers that we're kind of doing some of the legwork for. Some of the other groups we're going to have to depend on the local areas to kind of be the conduit and help us kind of get in front of them and give them as much information as possible. But we're aware that this is going to be considerable change, be a considerable amount of work, and we're just trying to provide the resources that we can for that. Does that answer your question, Mr. Chair?
Yes, it does. I wanted to make sure that we're covering that, and I know folks are working on it, but I want to make sure that folks heard that we are engaging, and we're going to be working with the local areas. And I know I feel very good that everybody's on the same team here. And whenever it comes to performance and accountability, whenever there's new conditions introduced in that process that's been in motion for a while, it creates a ripple effect. And so we're definitely going to make sure we're mindful of that, and we'll continue to work with everybody throughout the state. But thanks for your work on it. And I want to thank the local areas for their support as well.
Absolutely. Thank you.
All right. Any other questions for Dr. Wilburn and the Performance Accountability Committee? All right. I think we're moving right along here.
Thank you.
Thank you, Dr. Wilburn. Financial Oversight, Ames Barnett, owner of Barnett Southern. And as always, Mayor, the floor is yours, sir.
Mr. Chairman, you can't have me following up behind a doctor now. This is already tough, and now we're going over the budget. Yeah, we're gonna go over the budget, Mr. Chairman. We're gonna have some action items around the budget. But we had a meeting, I guess it was last week. Pretty much what's going on in the meeting is we did change the definition of participant to include services provided by rapid response. And so now those services provided by that are participants, and allows a better distribution of some funds of actually the staff work and different funding streams when changing the definition of participant. We got the 2021 budget. I'll be glad to go over it, but we'll have somebody that knows what they're talking about go over it, which would be Miss Kristen. She can explain this budget to you. And really, part of the main changes in it are the travel for board meetings and local on-site monitoring visits, line items back in. And then step back to standard state level expenses. And probably the highlight of the meeting was hearing from the CABs. You know, local area 5, the CAB, they got 750 participants enrolled in a virtual summer work experience, which has got to be virtual this year, but that's 750 participants. And it's funded through WIO and then by the county. So it's a partnership between Workforce DeKalb, DeKalb County Schools, and Georgia Piedmont Technical College. And I'm Not 100% sure, but I think last year was a little over 400 or the year before, and now we're up to 750. So that is, if you just do this every year, that's 7,500 Georgians over 10 years that's going to be trained like this. And it adds up one by one. So great job to Cab. And then East Central Georgia is doing a youth program. They got over 80 youth enrolled. And in it, and 14 have attained permanent employment out of it. And probably one of the main challenges right there is child care becomes a priority and needs support for participants. And just trying to get somebody to participate, get them trained, and at the same time not working, needing child care is a big challenge on that. And a little different demographic. That's a rural Georgia area, which is a little tougher, but they're working good, and they are partnering with the Family Connection, which is big in these local communities. And we heard from those 2 local areas. And that's the update I have. And then we'll let Kristen go over the budget for us. And then when she's done with the budget, we'll just need if the board wants to approve the budget.
Thank you, Ames.
Thank you, Mr. Committee Chair. So as Chairman Ames said, one of the things that we did last year was take another look at our cost allocation plan. We have, as you know, 3 funding streams: adult use and dislocated worker. What you might know about state level expenses is that for almost everything we charge, we have to divvy up the expenses of, a pencil or a desk or, an individual salary by adult use and dislocated worker. We're not allowed to just, say a third. It has to be a cost allocation that means something, and that's fair based on what the state serves. From a local area, this is a little easier because they do direct participant services. For state level expenses, it's a little more abstract. So our previous cost allocation plan was just based on the amount and the percentage of participants for the previous program year. Doing it like this made us charge about 50% of everything that we expensed to the adult funding stream, which is our lowest funding stream. In years where we received more funding, it wasn't quite as bad to do it that way. But as we've kind of seen cuts to our statewide allocation the last 3 years, it became more and more of an issue where we would get to the point where we had, kind of an exorbitant amount of dislocated worker funds towards the end of the year and be scraping by on the adult side. So we went through the process of relooking at our cost allocation plan. How could we put together a fair cost allocation plan that still made sense when you looked at the numbers? And as the chairman alluded to, we did look at our rapid response program and kind of expanded what we meant by participant as it had to do with the cost allocation plan to include rapid response services. As you know, we have a contractor, the Georgia Department of Labor, provide those services. And they send us detailed reports where we're able to kind of quantify what those services are. When we put all the numbers together, we had a consultant work with us to kind of get all of the paperwork and justification together. While it's not straight 1/3, 1/3, 1/3, it's now like 32, 34. And so that type of allocation between adult use and dislocated worker really enabled us to be on great footing with our statewide budget this year, even though we did take another cut. So I'm going to go by, not quite line item by line item, but if anyone has any questions, please feel free to stop me. Our salaries and benefits, this amount is similar to last year, although it is a smaller amount. Some of the structural changes that we made that were on the previous PowerPoint with the org chart enable us to cut our salary bill just a little bit. The next class is travel and SWIFT travel. This is going back up to the previous year's pre-pandemic travel level. Again, staff will be attending conferences if they are available again this year. And we are moving back to in-person monitoring and then hoping to get some in-person SWIFT meetings at the end of the year as well. Supplies is pretty much a carryover line item from the previous year. IT equipment, PeopleSoft fees, very similar to last year, as is rent and utilities. We did have to up our cell phone bills just a little bit. I don't know if you can call it a fleet of cell phones, but our OWD fleet of cell phones is getting quite old at this point, to the point where they're not able to receive some of the current updates, specifically with security that TCSG needs to do. So we will be updating some of those cell phones. That's why that line item went up a little bit. WorkSource Academy trainings, we will be putting on a WorkSource Academy conference, although smaller than previous years, but that will be going. And then obviously we'll be doing some other in-person trainings towards the end of the year as well, to complement the online trainings that we've been offering up until this point this year. SWIP contracts, that goes into, you know, the hotel, food, that type of contracts when we host in-person SWIP meetings. And then the next group of contracts on there are our data contracts. Some of these have not been negotiated fully for the next year, and we've carried over previous year's numbers. Those should only fluctuate by a very small amount, but almost always these are carryover numbers. So GeoSolutions, that is our case management system. The GDOL data agreement, that is our UI matching, and then also some of the risk data that Steven needs in order to do our performance. MZ and the MZ report, that's, you know, a lot of fun graphics and different data that we're able to show you guys, and also Burning Glass, which is how we do a lot of our labor market information. We do have some consultant contracts in there. That is mainly our Brustein, which is a law firm and federal grant specialist consultant that we keep on retainer. Those groups help us if we receive any federal monitoring. And then also when I was talking about redoing our cost allocation plan, that group is who helped us with that. FutureWorks is another data type system. GTRI is the group that helps us with our data integration. They work with us and our other 3 state federal partners to get closer to an integrated data system. CRM is our communication management system. And then one of the items that we have been able to keep on here is website overhaul and maintenance agreement. Again, we are planning to do some upgrades and just add some additional things to our website. And so that's the line item for that, and then just the continued maintenance of that. And memberships and sponsorships, again, this is a lot, plays into a lot with travel. As we start doing travel and things like that, we will be re-upping things like our SETA memberships. This also includes items like Max memberships, things like that, other professional associations that have to do with workforce. The GDOL rapid response contract is next. Again, this one hasn't been fully negotiated for next year, but this is the carryover amount from the previous year. And then a small line item for some statewide ex-offender programming. Are there any questions on the budget, Mr. Chair?
I had a
Mr. Chairman, do you have any questions?
I think there was one question being asked. Is that Karen?
Yes, I had brought this up in the executive committee, but I just was, and this, I guess it's not really a question, but just the work environment has changed with a great need for us trying to get people back into the workforce. There's a tremendous, it's not that there's a shortage of workers, there's just people are not responding for multiple reasons. And I had asked in the executive committee about programs or changes that might be addressed towards the adult section, trying to move folks back into the workforce. And I know there was some discussion around it. So while it's not a direct question on this budget, I did want to bring it up because it is a current need in our state. We desperately need workers. So like I said, it's not a direct question, but just thoughts around where we might make any future changes, or once this is locked down, is there an opportunity for moving funds to where it's needed? And I know, Kristen, you had responded to that. I just wanted to bring it up for the larger group that might be thinking the same thing.
Yes, ma'am. And, this is not necessarily a service-driven budget. This is kind of our admin level expenses at the state level. But one of the things that we try to do every year is to make sure that this is on solid footing and that there's also excess in those categories, because when we are allowed to carry over funds for 3 years. So these are funds that represent what we will be getting in its first year this year. Being able to underspend in these categories and have a budget that is less than what we will be bringing in enables us to carry funds forward into the second and third year. When we carry those funds forward into its second and third year, those funds are almost always used for additional local area programs. And so as a rule, we underspend what the state could spend on admin expenses so that we can be more nimble and give local areas additional local dollars to be able to come up with these programs to address certain things. And I think that that's also going to be something that's going to be really good about our current cost allocation plan. The last couple of years, a lot of the additional funds we've been able to make available have been dislocated worker and then sometimes youth, but almost never adult. But as you said, the need going forward is going to be largely an adult. So hopefully as we start to spend less in adult at the state level, we'll be able to make available more of those funds to local areas who need it.
And thank you. And I know you had to answer that for me on our executive call. I just thought others might be thinking about it. And it wasn't, as I said, specifically related to the admin budget, but more of the efforts and focus and direction that is hitting our needs for our state. So I appreciate you sharing that with the larger group. Thank you.
Absolutely. It all ties together. I appreciate the question.
Thank you, Karen.
Mr. Chairman, I'd like to present this budget to the board and seek y'all's approval.
So that you're presenting it as a motion?
Yeah, I'll present this budget as a motion for your approval, Mr. Chairman.
All right, there's a motion on the floor. We have a second.
Second, Kelly Brownlow.
Thank you, Kelly. Any additional questions or discussion? All right, hearing none, all in favor say aye.
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 Like sign opposed. All right, motion carries. Thank you, Mr. Chair.
All right, thank you, Mr. Chairman. Nothing else to report.
Great. And any other questions for Ames and the Financial Oversight Committee? All right, thank you again. All right, for the Executive Committee, next update, I'll cover a couple things here, and I think we're going to actually do a little bit of a poll. So we're going to a survey is going to come out to you here in just a minute. But the one of the things we discussed is the fact that due to the staffing changes and the restructuring of the org chart, a couple of the committee liaisons have shifted to new roles. So Cherie Olivis who's the programs manager, will move from the youth committee liaison. She'll now go over to work with Karen on the adult and dislocated worker committee. And Rosani Rios, our strategic populations manager, will now be the youth committee liaison. So congratulations, Cherie and Rosani. We appreciate your work and looking forward to you helping and serving on those committees. And next up, I'd like to announce two of our new board members who both are on today. Sam, if I get your last name, if I butcher it, I apologize. But I think it's Sam McCaughern is the president and CEO at Thomas & Hutton in Savannah, Georgia. And Logan Leslie is the founder and CEO at Northern Rock Looking forward to working with both of you. Thank you for your willingness to serve the citizens here in Georgia, and I'm sure you're going to enjoy working with the board members here. It's a great team, and obviously we're working on the workforce system is a huge priority, and we look forward to your value add to this entire process. So congratulations, and we're looking forward to put you to work.
Thank you. Look forward to it.
Wonderful.
Thank you.
Thanks. What I want to hit on now is the State Workforce Development Board retreat. And the location is going to be determined. And I will just a little bit of a reminder. Back in late 2019, we had actually, in one of our board meetings, 2019, we talked about, I wanted to bring us all together for a board retreat to go over strategy, goals, and to have a chance for the board members to weigh in on what we're doing, do a little bit of a deeper dive in some of the areas what the committees are doing, just a refresher on what's going on, and can make some connections with the local areas and our relationships with the local workforce development areas. And so that was our game plan at the late 19 that we were going to do in the early part of 20. And then obviously COVID hit and changed our world. And so the ability to do strategic planning and coordination over a long period of time, a day or two, doing that virtually is very, as we all can appreciate, is very challenging. And so we put that on hold. And our goal was that coming out of COVID, what's that opportunity for us to engage back together as board members? Well, as I said at the beginning of the meeting today, the world is evolving. Vaccinations and the folks are becoming more and more comfortable. We're still following CDC guidelines out there. Deputy Commissioner Kirchler and Kristen, I know that at the state level, as I understand it, they are opening up here starting next month. And so what we're going to propose is for our next board meeting, for those that are comfortable, we're actually going to want to do this in person. The executive committee, we talked about this for those that are comfortable attending in person. But what we'd like to do is take our next board meeting in August and use that time as our opportunity to do a board retreat. And you heard Karen Vier just a few minutes ago talk about our current conditions. There's some things that we want to cover and talk about as a board, and we feel like doing that it'll be some sort of hybrid, I'm sure, but at least getting a majority of us in the room to talk about these things at a retreat level will be more effective in our ability not only to assess and learn and train, but we know that ultimately that's going to give us, it'll be another connection point for us as well. So in order for us to determine, can this work or will this work, we need to get your input on your willingness to participate in something like this. So Nia, can we pull up okay, great. Does everyone see the board, the SWDB retreat poll on your screen?
Yes.
Yes.
Okay. So I think what we were supposed to do, Nia, is just simply click on our response.
Yes,
I'm
that's
doing
correct.
mine now. I'm doing mine now as I'm speaking to you. And I've clicked all my 3 answers and I've hit submit. Even I could do it. So I'm hoping that, well, I know that everyone else on this board is smarter than I am. So Nia, what we're going to do with this information, I'm assuming that you'll get the results. In fact, you might get them fairly quickly. But what we're going to do is take this information and then we'll do some more. We'll connect with you via email on what our game plan is. We'll base it on the results of this survey that everyone's completed today. And I realize that we'll have to look at calendars and whether or not it's 1, 2, or 2.5 days that works best for the team. One of our biggest things is how many are willing to meet in person. And that'll give us a feel for the opportunity for us to have this board retreat. So I've said a lot there. Any questions about what we're trying to accomplish with our next board meeting?
Hey, this is Jay Cunningham. Hey, if we're, on just a phone and not able to do that little survey, how do you need us to respond?
Oh, that's a
We
good
can
point.
email the poll to you, and then that way you'll be able to respond in that way.
Okay, wonderful, because I'm driving. I appreciate that.
Great question. Thank you.
Yeah, if anyone else calls in, if you could just let me know, that'd be great.
Wonderful. Okay, any other questions? All right, well, I'm hoping that we have a large response in the affirmative to attend in person. Because I'm definitely looking forward to seeing everybody and working together. And obviously what we'll be doing is working on our strategy and our goals. And so it'll definitely be a great experience. So, all right. The next item is that the Workforce Academy will be held in November of this year. And I think it was mentioned earlier, that'll be the date, the location will be determined later. But just know that I'm sure that's also going to be some sort of hybrid. It'll be a smaller operation, but we are planning on doing that here this year. So I'm looking forward to that. That's all I have for the executive committee. Any questions for me or any of the executive committee members who are the committee chairs? All right. Well, we'll keep running. Next up, we'll have a presentation from one of our very own board members, Evelyn Olenek, who is a Senior Vice President and Chief Nursing Officer at Phoebe Putney Memorial Hospital. Evelyn's going to cover COVID-19 and the impact on the healthcare industry, nursing workforce. We've all seen this over this past year, and these are all true heroes in the truest sense. And we thank you for your service, all of our nurses out there. And so, Evelyn, I'm going to turn the floor over to you for the presentation. Thank you.
Okay, thank you so much. And good morning, everyone. I am happy to be here and honored to be a board member sharing about the impact of COVID-19 on the healthcare industry, especially the nursing workforce. Now I'm going to rely on Andrea because I want to make certain we practice that I will be able to have my screen, and we'll go right into the presentation. And let's see here. Share. Okay, can everyone see this slide?
Yes.
Okay, great. So these are some of our numerous heroes, and these are the many faces of Phoebe that we experienced during our pandemic surge last year. In fact, let me tell you a little bit about Phoebe. And Andrea, I'm not able to advance. Okay. So we are located here in Southwest Georgia, and you can see outlined where we have, in the green, that's our primary service area extending out to our secondary and then our tertiary service areas. We are comprised of 4 hospitals, and of course, Phoebe Putney Memorial Hospital is our anchor flagship hospital with 450 beds. Phoebe Main, approximately 248 beds. Phoebe Sumter, which is in Americus, 76 beds, and Phoebe Worth, which is a critical access hospital, has 25 beds. We are a regional healthcare hub, and you can see, as I've identified, we have the 4 campuses. We have 3 urgent care centers, 11 primary care clinics, and 332 specialty clinics. By the numbers, we service a population of approximately 800,000. 42 counties are served and 5,500 employees. So large economic impact here. We have 337 employed doctors and advanced practice providers, 476 volunteers, 358 million in our payroll and benefits. And you can see 28 million in community benefits. So we represent a significant source of support to our community partners. And overall, the economic impact, 1.3 billion here to Southwest Georgia. So I always like to set the stage with regard to talking about the pandemic and the effect on nursing. But it's important to understand about the nursing shortage and what really is driving the changes across the country. So if a significant segment of the nursing workforce is nearing retirement age, we have approximately 4 million registered nurses in the United States. So think about nearly 1/3 will be retiring within the next decade. 70 million baby boomers, they're retiring with multiple chronic degenerative conditions. Healthcare is fabulous because guess what? We have extended the lifespan, but comes with that newer technology. And people, their longevity, 70, 80s, 90s, that is not uncommon. And so you have individuals that are living longer. And of course, they need additional care providers. And that takes individuals from the typical hospital setting. Healthcare reform. Healthcare reform has really changed the dynamics of the healthcare industry, primarily the acute care hospitals, because the delivery systems are changing, less inpatient care, greater accountability for outpatient care, the continuum of care. And I'm sure those of you that are outside of healthcare as industry leaders, you know the impact and you know what you're paying for employee provided healthcare coverage. And you want to have the most accessible, but you also want it economically provided to you as well. Movement to value-based purchasing and what that means for the hospital industry. That means keeping patients out of the hospital, providing care so that patients will remain healthier. But while care is in the hospital, there's a defined targeted length of stay. All hospitals are reimbursed on a typical length of stay in simple terms, and you equate your expenses and the care delivery to that particular length of stay. If you hit the target with the exact length of stay, let's say a condition requires 5 days, your expenses, your 5 days, and the patient is discharged, then you absolutely are within the correct zone. But if that patient has a complication and they're staying 6 days, 7 days and beyond, then certainly there is no additional reimbursement for the additional length of stay unless it's extremely warranted and it was beyond anyone's control. But typically Medicare and Medicaid and the other insurance payers will look at if it was harm created by the healthcare industry or a healthcare acquired condition, as we call it, then there is no additional reimbursement. So that's why it's incumbent upon care providers to do the right thing, follow evidence-based medicine, use particular clinical pathways so that we're decreasing the length of stay, preventing readmissions unnecessarily, and also preventing mortality when we could have prevented untoward effects. So all of this is increasing the intensity and the complexity of care. Projected physician shortage. And it was projected by the year 2025, there would be upwards of 42,000 less primary care physicians across the country. Well, advanced practice nurses provide a very viable solution to managing patients with chronic conditions. So there has definitely been an increased need for advanced practice registered nurses. Once again, moving nurses from the traditional hospital bedside. Additional trends, the nursing shortage faculty. In 2019, there was a study by the American Association of Colleges of Nursing. Upwards of 80,000 qualified nursing candidates were turned away from schools of nursing simply because there was a lack of nursing faculty. In 2019, there were approximately 1,600 open faculty positions in baccalaureate and graduate nursing programs, and this was in about 892 schools of nursing across the country. So you could see it's a significant problem. Insufficient staffing is raising the stress levels and burnout levels of staff. Instead of individuals hanging in there and saying, okay, I know the organization wants to hire, they job hop because the intensity and the complexity that I spoke about, not everyone is able to withstand that at the bedside. And so other roles are also available and created that take a nurse from the bedside to other support roles, such as in care management, such as in quality. All of these roles are important, but again, it increases the amount of registered nurses that you need in other positions. I call this next point predatory and toxic recruitment. And by that, what I mean is if one employer is offering a $10,000 sign-on bonus, then another employer has to up it by $5,000 and the other one ups it by another $5,000. These become unsustainable expenses for any employer. Generational differences in the workplace. We have 5 generations. What is good for someone who is in their 70s really doesn't always match with our Generation Z, the generation that grew up in a very digital world. It's not right, it's not wrong, it's learning just to be adaptive with our workforce and trying to create the best practice environment. Remember when I said the hospital is no longer the only destination for nurses? That is absolutely true. There are so many opportunities with that understanding and that license as a registered nurse, from other continuum of care clinics, advanced practice nursing, definitely education and vendor management, medical devices, pharmaceutical technology. All of these other industries beyond the hospital oftentimes require someone who is prepared as a registered nurse because they understand patient care and they understand how to relate to healthcare providers. And then certainly the COVID-19 pandemic and the increase in travel nursing, which we call it the travel syndrome, because that definitely has exploded and opened up opportunities for nurses that didn't exist. Now, travel nursing, contract nursing, that has been around for a number of years. Although several years ago, and let's go back to probably a 25, 30-year period ago, contract nursing wasn't the most desirable. It, served the needs of a certain number of the workforce, and it had to meet one's lifestyle. In fact, in some sectors, I don't want to, say this in a disparaging way, but it was not viewed as something prime. Hospital work, the bedside was the prime destination. Today, that has switched because contract nursing affords individuals, and remember we were talking about generational differences. The workforce today wants to be mobile. They don't want to be tied down to any one employer. They want to be able to work their shifts. They want to be able to command when they're going to take time off, when they're going to work holidays. So very rigid structure that existed in hospitals in days gone by, that has changed with the needs of our workforce. And so hospitals have to be very responsive, how to still create a workforce that wants to stay and that you're able to retain. The Georgia nursing shortage, this caption could have been in any one of our local papers. It just happens to be the Augusta Free Press a couple of years ago. And by 2030, the projected shortfall of nurses is about 50,000. And that still remains that number. That's the number that we target, that by the year 2030, and that's a short time away, in the next 9 years, 50,000 less nurses that will be available in Georgia. What also is causing this, and we'll talk a little bit about the pandemic, and I want to also give credit to this slide. Phoebe is working with the Southern Regional Education Board, in particular, Dr. John Pritchard. And this slide was actually in a presentation that Dr. Pritchard and others had presented to the Georgia State Education Board retreat recently. And partnering on the nursing pipeline, partnering on middle schools, high schools, getting individuals into the technical college system, and then those individuals that need to go on for a 4-year degree. But it's really talking about the problem and what the US hospitals were experiencing. During the pandemic, where was our greatest shortage? Critical care and emergency nursing. And it really was a crisis in particularly areas such as Southwest Georgia. When I was approached about talking about the workforce shortage and the impact of COVID, a comment was made that there were some, conflicting thoughts, because employers were hearing that in the Atlanta market, nurses were being furloughed, nurses were being laid off. But in markets such as Southwest Georgia, we were in a severe crisis of needing nurses. So this slide, this is our COVID-19 census, and I still get chills when I talk about this slide from a year ago. At our height, we had 183 COVID positive patients in our healthcare system. As you could see, those patients in blue were in the acute medical beds versus, ICU. We opened our command center on March 11th, and we just went forward with doing a phenomenal job in treating the numerous patients that presented to our hospitals as a result of the COVID-19 pandemic. And I think everyone is well aware, it really started with a super spreader that was present here for a funeral. There was a second funeral, and then there was a jury system, and the virus was rampant. I say our volume was fast and it was furious. If you would have asked me in February of 2020, were we going to be a hotspot in the state? I would have said absolutely no. In fact, I absolutely said that to my cousin. I was visiting in Florida. I said, you know, I live in Southwest Georgia. You know, not much happens down there. It's a great way of life, sun and sunshine. And if something's going to happen, it's going to be in Atlanta. Well, how wrong I was. And everyone knows we were the first hotspot in the state of Georgia. In fact, there was a caption in the New York Times at the end of March. How bad is it? Per capita, we were in the 4th spot following Wuhan, China, Italy, and New York City. So that paints the gravity of the situation we were dealing here in Southwest Georgia. We never furloughed an employee. We never laid anyone off. It was all hands on deck. And even when surgery was curtailed and we closed our outpatient services and we had to cease doing elective procedures, we re-engineered, retooled, reassigned. Everyone was working in this organization. And I give kudos, you know, to our board for supporting our system CEO and all of us in senior leadership, that everyone was still working and we were supporting the patients that were presenting to our doors. So let me share what this slide is all about. So prior to COVID-19, when we would work with a contract vendor to bring in nursing, I will say probably for critical care nurse emergency, anywhere in the ballpark from $75 to about $90 per hour that we would pay the vendor. Fast forward to COVID, in that time period, the number doubled literally to what we would have to pay a vendor to bring in nurses. So yes, you're doing the math quickly. $160, $180 an hour that we had to pay the vendor to get in additional contract nurses to, again, help manage the very complex patients that we were serving, because these patients were very, very acute, and we had to quickly make certain that the RN to patient ratio was manageable and it was safe, allowing time for donning and doffing of personal protective equipment. So the costs are just unsustainable. Costs without COVID, we are on target. 2021, our fiscal year ends July 31st. It starts August 1st. We're in the window. So far, 43 million. Total contract costs, and this is only nursing costs. This does not include our vendor agreements with EVS, food service, or our OB/ED hospitalists. You can see it's upwards of close to $62 million. That is not sustainable. And if we continue with a high number of COVID patients, which I will tell you gratefully, we are down to 21 COVID positive patients in our facility in our system right now. So it's very manageable, very low. We could have expended $92 million. Again, that is unsustainable for a healthcare organization. So it's very vital that we address our healthcare needs. I'd like to also share that as a result of regular staff working with contract travelers, that also caused an exodus of nurses from the bedside, because those that were able to be mobile and travel, they did end their employment so that they could travel and make these very lucrative wages right now. And it was something that, you know, we were not able to prevent. And many healthcare organizations across the state, as well as across the country, experienced the very same phenomenon. And eventually that will level off, but it was a challenge that we faced. So investing in our future workforce. So I've painted the picture of what was occurring. And right now, unfortunately, we have a 33% vacancy rate. And that means 518 positions here out of 771 positions are filled. We have a reliance on contract labor. And our contract labor with international nursing, we are employing 385 FTEs. Again, those costs, as you've seen, the excessive costs with contract labor is really creating a situation that we have to take hold of and we have to address. During the COVID pandemic, there were only 2 projects that were green-lighted. Everything else stopped in the way of construction. One was our $5.3 million simulation and innovation center that opened last year that is here to help investing in our workforce. It's 22,000 square feet of education and training for our nursing staff, as well as other educational partners, because we do have a family practice residency. We do work with the Medical College of Georgia, with our pharmacy students. We do work with Emory and other entities as well to prepare physicians, and we're training sites. But this specifically was created for our nurses. And you could see on the margin, we partner, with all of our, local schools of nursing, colleges and universities, from ABAC, Albany State University, Albany Technical College, Andrew College, Georgia Southwestern, the 4C Academy, which also is the local career high school track that we're able to bring students and introduce them to a career in healthcare. So it also is extremely beneficial because these, the high fidelity mannequins, it is a place that nursing students can safely practice without creating harm. And then when they actually transition to the real clinical environment, they provide greater confidence levels and knowledge of how to do procedures. There are some nursing graduates that when they finish their program, they have only inserted 1 peripheral intravenous line or inserted 1 IV. That's not the reality of what the nursing frontier needs today. So that's why the simulation center and using innovation technology was extremely important. Remember when I mentioned the faculty shortages? Alone here in Southwest Georgia, we're facing a faculty shortage of no less than 20. Between all of our southern partners down here, our southern schools, there's at least 16 full-time faculty, 3 part-time faculty that are vacant, with another 4 on the horizon that are going to retire. So again, that's a major problem, not having enough of our nursing workforce because we don't have faculty. So Phoebe is again taking a very active approach to investing with our partners, from our simulation and innovation center, helping to fund nursing educators at the various schools, our commitment to increasing clinical sites, our commitment to really increasing greater opportunity over the next several years up to 2023. It's a $7.5 million investment that we have planned and that we currently are doing right now to invest in our academic partners to create that nursing pipeline. When you talk about the vacancies just between 6 hospitals in our Southwest region, there are 948 healthcare vacancies for licensed professionals. Out of the 948, 584 are related to RN vacancies. It follows with licensed practical nurses, CNAs, respiratory therapists, medical assistants, medical technologists, pharmacy technicians, physical therapists, medical lab technicians. So as you can see, the need for healthcare workforce is significant here in Southwest Georgia. That's why it's incumbent upon us, as we're planning and involved in WorkSource Georgia, that we're working with our technical schools. We're working with the university system as well to partner to increase that pipeline, to look at the older worker, to retool individuals that need to have a future, and healthcare is definitely one way to provide that. We're also partnering with our local AHEC. And a year ago, we had planned to conduct a Southwest Georgia Nursing Summit. Well, the pandemic delayed that. And so we were able to move forward. And what that result of several partnership meetings with employers, with healthcare institutions, with our educational partners, we've come up with a roadmap, everything from education needs, clinical training, financial, pathway partnerships, policy and retention, a 6-month to a 36-month actionable plan that Senator Dean Burke and Senator Freddie Powell Sims were both involved in and are helping us to be that legislative voice as we prepare what are those actionable items. Because when you look at graduates that we have in our local market, and I'll take a few more minutes, that was my timer. Only 35% of the nursing students, 35% of the nursing students don't complete their degree. So that means we're wasting a lot of time and effort with students in seat without having the best match and the educational aptitude and that plan for who is going to be successful in a healthcare career. Also, when you look at larger markets, it's challenging to get into Atlanta schools of nursing. Remember, I told you 80,000 applicants were turned away across the country. Well, just figure out a percentage in Atlanta. Those individuals are coming down here to Southwest Georgia. They're not remaining in our community. So less than 30% of locally trained nurses stay here in Southwest Georgia. That's a problem for us because that number should be anywhere from 50% to 75%. Your local schools should be feeding your community. And when you talk about those are economic dollars that are going out of our region and possibly out of our state. The median income for a family here, the median income in our primary service area is $48,000. And in our tertiary rural area, it's $36,000 annually, that median income. A new graduate at Phoebe can start anywhere from $60,000 to $65,000 annually. That certainly is well beyond, the poverty level. It is certainly well beyond that lower median wage. So it really is important that we keep those economic dollars here and continue that flourishment and that survivability, as well as sustainability well into the future. I will close out now because I want everyone to think about that, the important impact. If you're in healthcare, absolutely, this is our world. We live it every single day. But as I mentioned earlier, other industry leaders, it affects you because if your employees do not have access to affordable, efficient, and effective healthcare, those costs, you are taking the burden of those costs on. You want to keep your employees healthy. You want to keep them vibrant. You don't want to have to face continuing escalating healthcare costs. And again, our country, I could go on and on and on about the healthcare crisis because there isn't a person who has an experience outside or within healthcare that the costs are oftentimes they're just insurmountable. And it's difficult to many employers to provide effective as well as affordable health care. And it really relates to all of us as well, maintaining a very healthy lifestyle and maintaining control of our health, which is far better than the illness-based model. I know that was very quick. I could speak for hours on the nursing shortage and the healthcare crisis that those of us in my role as chief nursing officer, that is one of the things that keeps me up at night, making certain that we can attract and retain the right workforce so that we can provide for the needs of our community and decrease a reliance on contract labor and get to a more manageable salary and wages benefit than paying excessive contract labor that really they're not staying in our community. I'm grateful for their help, but we really want to stabilize and have our workforce retained. I know that was very quick and I shared a lot of numbers with you. I am always available if anyone wants to contact me or speak further about the problem, but I do employ all of us as board members that as we're talking about WorkSource and how to help our communities, we really have to start early in our middle schools, our high schools, preparing students to have math and science, excellent foundation, the right aptitude for who's going to be an individual that's going to be not only an expert in caring, but an empathetic nurse, or who may need to go into a different healthcare career, because it impacts all of us. I thank you for asking me to present, and I will open this up to any questions if Chairman Dallas wants me to.
Yes, Ellen, thank you so much. I'm opening up for the board members. Any questions? You can either use the question, raise your hand or just speak up.
I don't have any questions. I just wanted to say thank you for the presentation. I do think there's a lot of our youth out there and our adults that are not aware of all the programs available, not aware of the training and the support that can be provided to go into some of these careers that they could have in the future. So I'm completely aligned with your thinking and appreciate the presentation.
Thank you. A lot of work ahead of us, but we can do it. And I'm not stopping until I personally am going to be involved in staving off this nursing shortage.
Miss Evelyn,
Awesome.
this is Mr. Chairman, this is Ames. I got a comment.
Yes.
Yes.
Miss Evelyn, if you want to look into a program called Culture Index, if you email me, I will. We started it in our industry, and it is takes like, this is what the job requires, and this is the way you're naturally wired, detail oriented, people oriented, and compares up the perfect. And so we're going into the school system saying these 10 employees have perfect personality for this job, and that's the ones we're focusing on. And we've reduced our number of, I think about 95% of them will fit in the job we're putting them in now.
Great.
So
Thank
if you email me, I'll send it to you.
Okay, I will email you because many of our college presidents said that is a problem because, you're admitting so many, but not everybody. They have to do a better job of matching their skill and aptitude and those empathy profiles to who should go into healthcare. So thank you. I will email you.
I mean, Kirby Smart doesn't put offensive lineman at running back, but we're trying in the workforce to make a lineman a quarterback, and it doesn't work, and this can eliminate that.
Good point.
Very, very good, Ames. Any other comments or questions? Well, Evelyn, thank you again. Just really on two fronts, focusing on the nurses in our nation and what they've done during this pandemic, and then also from the standpoint of a workforce standpoint, how you're managing here at the local level. When you said 33% vacancy, I was like, wow, that's a huge challenge, and many are seeing high numbers, double-digit numbers right now. So, and some great points and ideas that you shared with us. So, thank you again.
You're welcome. Thank you.
All right, let's move on to our next. Last item is the monitoring summary, and Brittany Walsh is going to cover this for us. So, Brittany, I'm going to turn it over to you.
Thank you, Mr. Chairman. Let me share my screen here so I can go through it. You can see it, right, Nia? Yes. Okay. So every year we give you guys the monitoring summary report. Let me do full slide here. So the full report, of course, is posted online. We're going to just hit the highlights today. We'll have the link for the full report in the materials you receive after today's meeting. So if you want to take a look at the whole thing, we've got it there. And so obviously, as we've already talked about many times today and in other meetings, COVID kind of threw a wrench in our normal process here. And so this slide kind of highlights the high level process that we did. Obviously this year we went completely virtual, which the main things that changed were our entrance and exit meetings, as well as interviews were conducted via video conference. We did have some delays for a couple areas due to COVID related closures or staff being ill. But for the most part, the schedule stayed on track. We wrapped up the last monitoring review in March, and we are currently in this last phase here, the corrective action phase. We have already closed out 12 of the 19 local areas, which means that they have resolved all of their findings. And the remaining areas with open findings, we expect to close out in the next month or so, and we're working with them on those efforts. So I'm going to go into each of the team highlights from this year before I dive into the results of the findings that we gave. So the big thing for finance was that they had very minimal findings this year, which we credit to the increased amount of technical assistance Dr. Walker and her team did. They also issued some additional policy directives and in turn improved our internal processes. And that sort of helped kind of alleviate some of the issues we were seeing before.
Dr. Walker's team is going to be creating some additional training and guidance to send out to the local areas. You can see those listed here. We've already done one on subrecipient oversight, and that went really well and was well received. And we see the fruits of that labor in our monitoring and local processes improving. For programmatic highlights, obviously programs does the bulk of our interviews while we're on site monitoring, so they had to shift to a virtual platform there, make sure local staff were comfortable and sharing those updates, and they did a great job with that. The other big thing that programs implemented this year was having a programmatic review with local staff once they identified their findings. Of course, when we exit with each local area, we go through the findings and required actions, but some of these issues are a little more nuanced. And so Cherie and her team sat down with the local areas, had a chance to talk through the purely programmatic findings, so that by the time we got to an exit meeting, everybody felt comfortable with it and knew what was expected moving forward. Again, we did a lot of trainings this year. Programs led a lot of them, and those seemed to be well received. For compliance, our main role in monitoring is kind of shepherding the process throughout the week. Normally we rotate the team lead responsibilities, but this year compliance took it on completely so we could have some consistency when everything else was a little crazy and up in the air. So we had to do a lot of troubleshooting of these new platforms, updating our processes, and really focusing on communication, both with our internal staff as well as with the local areas. And then the other big things, again, center around training for compliance. We have developed what we're calling internal resource guides to help facilitate the onboarding of new state monitoring staff. So kind of walking through the process, how to write a finding, just giving them sort of like cheat sheets and other guidance to help them as they do, their first monitoring trips, and making sure that local areas are getting consistent service and information from us. USDOL has also put on a state monitoring training series recently, so my team has been attending those, and there's some pieces of information we're pulling from that to do some staff training for us leading into next monitoring season. There's been a lot of really good information covered there, so we're excited to implement that. We've touched on a few of these things already, but I'll just briefly hit the challenges and opportunities from this last season. Again, everyone had to adjust to some technology barriers and shifting our processes. I really want to shout out the local areas for their patience and for their efforts in doing this. It took a lot of work from all sides, so I really appreciate all their efforts there. Another challenge that we face with new monitoring staff in particular is that every local area is a little bit different in terms of organizational structure, obviously. So, the way the local staff, fiscal agent staff, everybody at the local area interacts is a little different. And so we try really hard to make sure that our state monitoring staff understand those local differences so that we can really dig into the local operations and fully understand what's going on there, so that we can have a quality review of their operations. And again, time management and communication are obviously huge things every year. This year, it was even more important with everyone, on a remote schedule. We're all spread out. We put a lot of emphasis on making sure our teams were communicating and that we were staying in tune with each other. Now, to get into the meat of our actual findings from this year, this chart shows you a breakdown of how many findings we gave for each testing area. And we're actually going to move into some of the other slides because they dig in a little deeper on this information, but this is just the summary. Let's skip the map for right now. So this chart gives the breakdown of findings for each area and compares last year to this year, of course. We did have more findings this year, and as you may have noticed from that last chart, most of those findings were programmatic, which is typically the way it goes. They have a very large area that they review with policy and case files, so we see a lot of programmatic findings. To hit the high points, a lot of these came from missing elements in policies, specifically work experience, our veterans referral processes, and youth supportive services, as well as some issues with work experience contract elements, and then some missing documentation mainly focused around follow-ups. So these are the type of trends that we look for at the end of monitoring to kind of develop technical assistance. So we'll be looking to issue some more guidance and training around these areas to help address those deficiencies. in addition to, of course, the specific prescribed corrective actions for each local area that got those findings. So in previous years, we've showed you all the breakdown of last year versus this year findings by testing category for each team. However, the way that information has been presented makes it look like there are more repeat findings than there really are. So we thought the better way to highlight this is the next 3 slides are going to break down the testing categories for each team. And then I'm going to highlight where we give the most findings and what all is included under those umbrellas to kind of give you guys a little more color to what type of findings we give. So for finance, you can see all their testing categories are here. Contracting is where we give the most findings. I believe it was 8 that we gave this year. But that can include anything from missing signatures, missing required provisions. You may be outside of your period of performance, you didn't identify a subrecipient. Of course, if your contract templates aren't updated. But then the big one that kind of increases this number is anything to do with one-stop MOUs will be covered under contracting. So there's a lot of different things that fall up under this. Again, the way we've presented it in the past makes it look like everyone's getting contracting findings over and over, but they're for different issues every time. Which, to take it back to the finance highlights, is why Dr. Walker's team has obviously done some training and issued some additional guidance on, what's required around contracting, just to kind of help alleviate some of those issues in future. Now for programs, programmatic administration of all of our testing categories across teams is the widest umbrella. That's going to cover, anything from you have a policy missing entirely, maybe it just has a few pieces of incorrect information, or it doesn't adequately cover the scope of a certain policy area. So we want them to beef it up a little bit. But that also includes missing case files, and then any missing documentation that doesn't fall into some of these other categories like eligibility or support services. All of that gets lumped into programmatic administration as well. And then, of course, some of the bigger items that could fall under this are if an area fails to meet their work experience or out-of-school youth expenditure requirements, or if they fail to certify their one-stop areas, or one-stop centers. So again, it's a wide umbrella. It looks like there's a lot of repeat findings for programmatic administration, but it just covers so much in that category. And then the final one I wanted to cover is for the compliance team. So there are 2 areas here that we give a lot of findings for, internal control environment being one. Again, this is a fairly wide area because it can also include any policy issues. And some of these things do come from the programs and finance side. So for example, if it's a programmatic policy that has an issue, that'd be a program administration. But if it were finance and programmatic policies or a wider spread of policies that we noticed there were problems with, and it leads us to believe, hey, you haven't touched your policy in a while, you haven't done updates, we would consider that an internal control environment issue instead of programmatic administration. And again, things like not approving the budget, failure to submit monitoring documents, or just a general lack of procedures and policies would fall under this as well. But the other area and the final thing I wanted to cover is the local workforce development board. That is a huge part of the compliance team review. Obviously, everything that happens at the local area is a product of the local board decisions. And we really want to make sure that they, have compliant boards, everything is working the way it's supposed to so that their programs can run the way they're supposed to. So we do see a lot of findings for, some minor attendance issues, if they've got vacancies, things like issues with their bylaws are all covered here as well. So again, the full report is available online. The link is included in the PowerPoint that you'll receive from Nia after this. So if you want to review the whole thing, that'll be available to you as well. But that concludes my report, Mr. Chairman, unless there are any questions.
Thank you, Brittany. I'll open it up. Any questions? All right, very good. And I know, thanks for including the information in the presentation so folks have an opportunity to look at it. And also just as you stated, the way you've outlined it and what we're doing and how we're following up, that everyone always wants to know, well, as a result of what you're finding, what are we doing about it? And so feels like we've got a good process in place to close those gaps, and that'll drives what part of the training is as well. So thanks everybody for your work on this. Okay, Nia, Kristen, I believe this brings us to the end of the agenda. There's no other items on our agenda to cover. I do want to hit on a couple of things. One question that came up is around about the local workforce offices. Kristen or team, do we know if any of those are beginning to open up and providing in-person services, or is that done by case-by-case circumstance? I mean, do we have a feel for how that's going?
Yes, and we can provide, Cherie keeps a log of the availability of all the local offices. It is a case-by-case basis because each of the 19 local areas are attached to a local government or a regional commission. So they follow the opening, closing guidelines of those governments and regional commissions. The other thing that makes some of the opening and closing decisions a little complicated right now is that in a lot of cases, our local areas are combined with other agencies. And so if we rent space from, like, say, the Georgia Department of Labor and they haven't yet opened, some of the local areas then won't be able to open, or, they're using their mobile units, or they're, trying to get space in libraries and things like that. So it's really a mixed bag, but I would say all of the local areas are open in some way, whether it's taking appointments or doing kind of case by case. We've got some local areas who really didn't even close for that long of amount of time. So if that's something that the board is interested in, we can kind of send the opening and closing information that we have right now.
Yeah, that would be good. Please do. And so the few that need the information or want the information will get it. So that's a good idea.
Absolutely.
Thank you. And folks, I know I do want to recognize one individual before I adjourn, just as a point of privilege. Chuck Little, I know you're out there. I heard you chime in a second ago. I've known you for a long time, sir. And for y'all, Chuck is retiring from the Atlanta Electrical Contractor Association. Chuck, correct me if I'm wrong, but I think that's it. And just wanted to give you a minute or two here to say a few words to the board, because I know that's a big decision and we're going to miss you.
Well, thank you, Chairman Dallas. After 21 years of doing workforce development, a paid career and a volunteer career, it feels weird to say I'm leaving the workforce. But that's the case I've decided to do. But I really have appreciated, Chairman Dallas, your leadership all these years, and the leadership team that you've had all these years. It's really been great working and serving with you. In addition, we also need to appreciate, the heavy lifting, but the staff does, the state staff does. We really appreciate that I've seen them do all these years too. And then beyond that, I've worked for the local Atlanta Regional Commission Board, and that's where you get your feet down closer to the ground, and that's where you hear the stories about the services that we provide and the people we affect. And that's really been a value and made me want to keep on going, in the years that I've served. And then lastly, two people today mentioned the word aptitude. Ames and Evelyn both mentioned the word aptitude, and I've planted seeds for the last couple meetings, so I'm going to give you a challenge. There's survey instruments out there that are so important that we at the state level maybe need to see if we can do an RFP to get a state level RFP out there so that we can identify a survey instrument that really is the most valuable one that we can then provide to the local boards, because that's so important, as you heard by Ames and by Evelyn. It doesn't matter the industry, in our industry too. Yeah, we can do all this recruiting, get people, but if it's not the right person in the right position, you lose them and you've wasted all that time. So I'm hoping that the state at some point can come up with an RFP to get out there and come up with a good survey instrument to do that.
Hey, well, Chuck, I would be disappointed if you didn't reinforce that, because, sir, you're still working, and we are so grateful for your service. And I selfishly for the state of Georgia. We thank you for everything you've done and are doing. Your influence will still carry on, and I appreciate you much, sir. And listen, Chuck, I know we've worked together. We're friends, sir. So I'm looking forward to staying in contact with you, and we wish you much success in this next step.
Thank you, and fellow Gwinnetians too, I guess.
Yes, that's right. Awesome. Thanks again, Chuck. All right, any other comments for the good of the order? All right, hearing none, folks, thank you very much for your participation, all the presentations. Looking forward to checking the survey results. You'll hear from us soon on what the next steps are going to be. And I hope to see many of you in August. Until then, reach out to us if you need anything. Have a great day, and we are adjourned. Thanks.
Thank you.
Thank you, Mr. Chair.
Thank you.